Preparing for your virtual visit by the Chronic Pain Clinic at the Hospital for Sick Children. This video will show you how to prepare for your child's upcoming virtual visit. Your pain team is available to answer your questions by phone, email, or video call. Before your virtual visit, what you will need for your appointment. Technology. When preparing for your virtual care appointment, you will need to make sure you have access to the internet, a laptop or desktop computer with audio and video. A tablet with audio and video that can be set up in a stable way is also acceptable. If you do not have access to any of these devices, you can try using a smartphone. Please make sure you have provided the team with a phone number where you can be contacted in case there are technical difficulties. It is also suggested that you limit the number of devices on your Wi-Fi network to ensure maximum bandwidth for the duration of the appointment. Appointment location. You will need to find a private space with enough room for your child to stand, sit, and lie down in so they can be assessed by the physical therapist and pain doctor. You will also need to make sure a caregiver is present with your child. Clinic checklist. The online questionnaires that were sent to you must be completed before your appointment. These are important and help to guide your child's care. Your appointment will be confirmed once the completed questionnaires are received. Also, please prepare any questions you may have for the chronic pain healthcare team. You will also need a toothpick or pen cap and a tissue that may be used during the physical examination, a hair tie to pull hair back from the face and neck areas, comfortable clothing your child can easily move in. During your virtual visit, what will happen during the appointment? Virtual clinic overview. Here is a short overview of what will happen during your appointment. At your first appointment, you will meet some members of our team, including an anesthesiologist or pain doctor, a psychologist, a physical therapist, an advanced practice nurse, and sometimes a trainee. Other members of our team you might meet at later appointments include a psychiatrist and an occupational therapist. Chronic pain is complicated. Therefore, we have different specialists as part of our team, each providing different types of assessments and treatment. Our clinic uses a 3P approach to treatment. This involves a combination of physical, psychological, and pharmacological strategies. Using all three together improves pain, sleep, mood, and function better than one treatment alone. Your virtual care appointment will include a detailed pain history, a general health history, a focused pain physical assessment, an explanation of your pain diagnosis, a treatment plan, and next steps. The physical examination. The physical therapist and anesthesiologist will complete a targeted physical examination with your child. This will take about 15 minutes. Your child will be asked to demonstrate various movements while sitting, standing, and lying down. If required, they will also be asked to complete a sensory evaluation using a toothpick or pen cap and a tissue. Patient and caregiver interview. Your child will be asked age-appropriate questions that may include what are their stressors, whether they have any substance use, and what is their understanding of their pain condition. A psychologist may interview the caregiver while the child is being examined by the physical therapist. This will require an alternate phone where the caregiver can be reached separately. Wrapping up. After completing the history and physical exam, you will be asked to log off the virtual care appointment for 10 minutes. During this time, our team will determine the pain diagnosis and treatment. After 10 minutes, you will log back into the virtual care appointment and the team will provide you with their diagnosis, treatment recommendations, and next steps. At this time, you may ask our team questions and provide feedback. After your virtual visit, what you will get from the healthcare team. An after-visit summary will be emailed to you that includes all the healthcare providers' names, your child's pain diagnosis, treatment recommendations, next steps, and a satisfaction questionnaire that will help to guide us in providing the best quality of care for our patients and families. That's it. You are all set. We look forward to meeting you. If you require any technical support or more tips on how to access your virtual appointment, contact the OTN Help Desk at 1-855-654-0888. If you have questions regarding your appointments, contact the Chronic Pain Clinic at 416-813-6975 or chronicpain.clinic@sickkids.ca. We are here to help. If you want more information on chronic pain, please visit the Pain Learning Hub on About Kids Health and the Chronic Pain Clinic webpage on sickkids.ca.